Welcome, learners. We are here today to understand about the certificate course in cardiac nutrition and health. I'm your instructor, Apurva Rao, and we will be doing a brief overview of the entire course. So let's just dive into it. So totally, we will be having 12 modules in this particular course. To just give you a brief gist, we'll be looking into the introduction to cardiovascular health. Then we'll be moving on to lipoprotein and metabolism, followed by risk factors for CVDs. We'll be touching about atherosclerosis and arteriosclerosis, hypertension and hypotension, and also hyperlipidemia. Following that, we will be going into different heart conditions, and then we come to the nutrition approach to cardiovascular diseases, in which we will also be specifically focusing about micronutrients and heart health, the functional foods for the improvement in cardiac health. And as we all know, so we will be also seeing the role of physical activity and heart health. And also in the end, we'll be just going into a few case studies. So let us dive into each module a little more in depth. So when we're looking at module 1, which covers the introduction to cardiovascular health, we are going to understand the epidemiology of cardiovascular health, the prevalence and incidence, and also its impact on mortality. In module 2, which is lipoproteins and metabolism, we are going to look at what are lipoproteins, what is cholesterol and triglycerides. And we'll be looking at the different types of lipoproteins based on density, on electrophoretic mobility, and also the apolipoprotein content. Module 3 basically encompasses the risk factors for all the different types of cardiovascular diseases, in which we look at how to assess risk, the markers in blood, the inflammatory markers, and also what are the risk factors for developing these different cardiovascular diseases. Module 4, where it is mainly about atherosclerosis and arteriosclerosis, we will learn what is the difference between the two, the role of fat in the development of atherosclerosis, the clinical evaluation to detect atherosclerosis, and also its dietary management and prevention. Module 5, where we'll be looking into hypertension and hypotension, we'll be starting off with the etiology and prevalence of hypertension, and then look into its pathogenesis. We'll also be learning how to understand high blood pressure readings, the causes, types, and symptoms of high blood pressure, followed by the treatment options for hypertension and also its dietary management. In this module itself, we'll be also covering a little bit about hypotension and also the treatment options for the same. Module 6, where we are going to understand what is hyperlipidemia, and we'll delve into its pathophysiology, the different types of hyperlipidemias, and also the dietary management for hyperlipidemia. Module 7 is primarily on the different heart conditions that you would come across in the day-to-day scenario. And we'll be starting off with ischemic heart disease, where we'll be looking into the different stages of development. We'll be touching about angina pectoris, myocardial infarction. In congestive heart failure, we'll be also looking at the pathogenesis and the different stages of it. Following which, we'll go into acute and chronic heart disease. And the last one in this will be rheumatic heart disease. Coming to module 8, which is the nutrition approach to cardiovascular diseases. Primarily here, we'll be looking at the medical nutrition therapy for all the cardiovascular diseases. And in that, we'll be looking at the principles of diet, therapeutic lifestyle changes, the National Cholesterol Education Program, the Mediterranean diet, which will also include the Mediterranean Diet Tool Score. And we will also be looking at weight loss and its implication on heart health. Module 8 also covers the role of fat in management of CVDs, that is the role of saturated fatty acids, unsaturated fatty acids. We'll also be looking at the link between omega-3 fatty acids and heart health. and if and does dietary cholesterol have an impact on our lipid profile. Role of fiber in the management of CVDs and role of carbohydrates and proteins in heart health would also be studied. Coming to module 9, where we are going to learn about micronutrients and heart health, we are first going to understand the relationship between antioxidants and vascular health. We'll be then moving on to the important micronutrient and its impact on prevention and treatment of cardiac conditions, and also understand a little bit about the drug nutrient interactions. In module 10, we'll be learning about the different functional foods for improvement in cardiac health, where we'll first be looking at what are functional foods, the roles and benefits of individual functional foods in relation to heart health, and also the relationship between bioactive compounds and heart health. Module level is primarily focused on physical activity and heart health, where we're looking at how does physical activity have an impact on heart health, the different types of exercise interventions that can be undertaken, and also the contraindications to exercise in certain cardiac conditions. Which brings us to the last module, where we'll be looking at all the different case studies pertaining to these cardiovascular conditions. So this brings us to an end of our overview on the certificate course of cardiac nutrition and health. I'll be seeing you all soon in the course.